Hi everyone, Dr. Holinbeck back. So this is a follow-up video to the last one where I talked about the consequences of missing teeth. So now let's talk about what your options for replacing those teeth are. And I'll use this little demo. I'm excited about getting this little demo. So you can see this very loosely emulates what's going on in the mouth when you're missing a tooth. So in the last video, I talked about that bone loss, and you can't really see it in here, but when I talked about it dropping down in the mouth, you'll actually see it drop down below here. So a few of your options are, you've got three. One, a removable partial denture. The second is a fixed partial denture, or something called, loosely termed, a bridge. And then the third option is a dental implant. So with the first option, I really don't have a way to show it on this demo, but it's essentially a denture. I think a lot of us have seen people that wear dentures. It's something that goes in and out of the mouth. At nighttime, it's typically recommended to soak it in some liquid. The pros and cons are the denture is more economical. It's a quicker turnaround. It's something that it's not really going to function like your tooth. It's not even going to get close. And some people struggle with how comfortable it is, especially if you've got a metal-based partial or depending on what that material is. But it's a very good economic way to give the appearance that a tooth is there. And some patients will use that as a more long-term solution. And I've got a lot of patients that use that as an interim. In other words, they're using this until they're ready for something more definitive, like a bridge or a partial. So that's the first option. The second option is your dental bridge. So the way that bridge works is, so you've got your teeth here on either side, and this one here is missing. So in order to get a bridge placed on here, these teeth on either end are going to have to receive crowns, essentially. So those teeth are trimmed down, and then something is fabricated that's essentially crowns, but they are connected, right? And you can see how it's now replaced that tooth, mainly above the bone, and this unit is connected. So the benefit to this bridge, I'll bring it here so you can see a little bit better, is that it's going to look pretty close to, we can get it aesthetically so that it looks like that middle tooth is on its own, but it doesn't function that way. You're not going to be able to floss here freely. You'll have to use a floss threader to get underneath there. That's not the end of the world. The concerning thing to me with the bridge is that it does require me to trim down the adjacent teeth. And so that loss of tooth structure can be a tough pill to swallow. If those adjacent teeth need work anyway, let's say they're bombed out, they're broken, we're going to be restoring them in some capacity anyway, then it's really not, it's not that drastic, right? We're essentially killing two birds with one stone. But it's really tough to swallow when those adjacent teeth are healthy. They're what we call virgin teeth. They've never needed any treatment before, and we've got to go through and obliterate that. The research tells us that whenever we have to put crowns on teeth, we increase the risk of those teeth needing root canal therapy. Now, sometimes we have to do what we have to do. We really don't have an option. But if we have another alternative that allows us to save that adjacent tooth structure, that's the ideal way to go. But the benefit to the bridge is that it's quick. We can get those teeth prepared, send it out to the lab. But about 3 weeks later, we've got your final bridge and we can bond that in there. And I've got plenty of patients that floss underneath and around there without any issue whatsoever. But if you ever have any issue with one of these teeth, then the whole 3 or even in some cases 4 unit bridge is compromised. The last option is a dental implant. So the way an implant works is, let me get my model here set up and then I can show you. All right, so you got the tooth missing again. I'm actually going to turn it around so you can see the inside of this model. Here are the tooth roots, and that's the part of the tooth that we don't ever see. we shouldn't see it. If we're seeing it in the mouth, then something's not healthy. But that's the part that's below the gums. So what a dental implant allows us to do is replace that single tooth by itself without involving the adjacent teeth. So we get to save that tooth structure. We can engage this implant underneath where we don't see, and then we get to restore it, build it up, put a crown on top of it. So it gives the look like this tooth is coming out of your jaw. So now there's pros and cons to a dental implant, and I can address that more in another video. But the big benefit to it is it engages the bone. Now, if you saw my last video, that's one of the big consequences of missing a tooth, is that bone starts to resorb. It doesn't have a job to do. It starts to go away. But that dental implant can engage that bone so that that resorption is drastically slowed. And then we get to put a tooth on top of it, a crown, and we get to floss these teeth like normal, brush these teeth like normal, treat this tooth as if it were our natural tooth. The function is, it's distributing the forces better. So in the ideal situation where someone is healthy and we've got enough bone, I think the implant is the most ideal way to go. If there are some issues with health or bone, some anatomy, some access issues, then the bridge is a good alternative. But just be aware that it doesn't engage the bone, and it does cause those teeth to be connected, married to each other, and changes the dental hygiene a little bit. So I'll have another video where we can talk more in detail about implants, and also talk to you about the difference between zirconia implants, titanium implants. We'll touch base in a little bit.